Welcome back. It's time for this week's edition of KETK's Gives Back, a way for us to thank first responders and caregivers for the sacrifices they make to serve and protect us every single day. This morning, KETK's Perry Elliott Durrani is with the UT Health in Tyler. Good morning, Perry.
Hey, thanks for joining us for another edition of KETK Gives Back. Today, I'm very excited to introduce you to the brave men and women over at UT Health, specifically their emergency room and COVID units. Now, these folks, I don't have to tell you, really busy right now. It's really special that they took time out of their day to talk to us about what they're seeing, and I can't wait to introduce you to them. So first, let's go over to Dr. Kenyon, sir. How are you?
Good, good.
All right, now you say good, but I understand you guys are working with a lot right now. Tell me what you're seeing.
So we're seeing a pretty massive increase in numbers of patients that are coming in, both in the emergency room and those being admitted to the hospital. Lots of COVID positive patients. It seems to be affecting all age ranges of people, 95% of which happen to be unvaccinated, but it's really putting a strain on us, putting a strain on the hospital and the rooms that we have available to take care of people.
And give me an idea too, long hours, right? The long days, right?
Yeah.
You pull in extra shifts to help people out.
Absolutely, extra shifts, and you know, you get a provider or a nurse that goes down with COVID and can't come to work. We've got to fill those spots, and so everyone's picking up, working hard. Everybody's got a good attitude about it and trying hard, but it's rough. There's lots of extra hours, lots of extra shifts. So.
And I'm seeing that among your team, y'all, you know, keeping each other through. And to help give us an idea of what they're dealing with, I want to introduce you to Jenny over here. She is in charge of managing the COVID team. Jenny, tell me a little bit about what it is that you guys are seeing, how you're getting each other through these long shifts, long days.
Yes, sir. So all of my nurses are in overtime, working long hours to provide care to all of our patients. They've been doing this a year and a half, so they're exhausted. They're worn out. They're tired. They are probably the most passionate group I've ever had the pleasure of working with. So together they pull that energy and help motivate and lift each other. They even do it by making jokes at each other just to keep each other laughing throughout the day. And their teamwork is truly remarkable. We could not be blessed with a better COVID ICU team in our area. But we need help. They're tired, and we need help.
No kidding. And I want to talk to you, sir, Fernando. He's a nurse with this unit. And tell me a little bit about how you push through those long hours. I imagine there's a lot motivating you, helping people out here to make sure everyone gets through the day.
Help from your coworkers, teamwork makes a big difference, but I think we need help from the community also to help all of us get better and get over COVID.
So much teamwork, so much going on behind the scenes to really keep you guys going. And tell me a little bit too how you're making the logistics work, because we talk about long hours and long days, but when you're talking about a hospital system, lots of patients, it's a big deal.
It is a big deal. Some of my nurses do pull 16-hour shifts in order to accommodate our patient load. They do so very gracefully. We just try to always remember, no matter what our actions are, it's all about the patients, and that's kind of one of our mantras. It's all about the patient, it's all about the patient, it's all about the patient. Have grace for yourself, have grace for others, and together they've seemed to make it so far. I encourage them to take a day off, so when they've worked a lot of shifts, I make them take a day off. If that means that I will have to come in and help them, that's okay. But it takes all of us in our facility, from our patient care techs. We have amazing patient care techs, and they step in and they're helping us with infection control. Our respiratory therapists, our case managers. It literally takes every human being we have at UT Health to make it work right now, because we are so stretched thin from the doctors, the nurses, the PCTs. We're stretched. So, but we're a remarkable group, and we've made it work so far.
Right, yeah, so much work, and we're running out of time here, but I really wanted to give the doctor over here a last chance, because they are working so hard, tirelessly, selflessly, long hours, long days, to make sure that people out here are safe. And I understand you guys helping out the community so much. Is there anything the community can do to help you guys out?
Absolutely. I think you can hear from everybody that we're stretched. You know, everybody's working hard, and we're here to take care of people. We want to take care of the community, but we really need help. I think the biggest thing is getting out and getting your vaccination. They've been proven to be safe. They're very effective. Like I said earlier, 95% of people we're admitting are unvaccinated people right now, and so get out there, get your vaccines, and let's be smart. Wear your masks. Let's do our social distancing. Wash your hands. These things all work for us and certainly help.
Well, thank you so much for taking your guys' time. I know things so busy right now. This is another edition of of KETK Gives Back. Each and every week, we are giving back to first responders around East Texas, and I can't think of a better group to be thinking about right now as they are out there in the community. All of this, of course, made possible by Peter Chevrolet stepping up this year, really helping us reach out to these folks and thank them for the hard work that they are doing each and every day. We have lunches for them. We know they deserve it, so we're going to go ahead and let them enjoy those. In the meantime, I'm over here in Tyler, Perry Elliott Durrani reporting.